This program produced by Union Pacific Railroad. Few companies employ a workforce as large or as diverse as Union Pacific Railroads. Every day, tens of thousands of our employees work together to ensure thousands of our trains transport our customers' goods safely and efficiently. It's a huge and daunting task. Train crews and track workers, office support and repair personnel are just a few of those who keep these trains on schedule and on the rails. Think about it. When working with heavy railroad rolling equipment, every employee must be constantly aware of his or her actions. A seemingly small mistake may lead to costly incidents and major consequences. Daydreaming or inattention can place you and many others at serious risk. At any one time, it's estimated that 20%, 1 in 5 of the nation's workforce, may experience various forms of depression. For these workers, focus and concentration on their jobs can be difficult, if not impossible.
Dispatcher 42 over.
Depression can strike anyone, regardless of age, gender, socioeconomic status, or ethnic background. Depression is a serious medical condition that disrupts personal health and families, contributes to lost productivity, and potentially contributes to a number of adverse safety-related incidents at work. Employees should learn to identify the symptoms of depression in themselves and others, and then seek or recommend adequate treatment. Unfortunately, most people do not know what to look for. And when individuals do realize they have symptoms, about a third still fail to seek and receive treatment. Thus, they suffer needlessly because of the unrealistic stigmas surrounding depression. This program provides information in both these areas, recognizing symptoms and getting help. Often a combination of factors can trigger a depressive disorder. These could include genetics, trauma, the loss of a loved one, financial problems, or a difficult relationship. It's not a sign of weakness to recognize symptoms of depression and seek help. Depression is a medical disorder and should be treated as such. Depression is more than occasionally feeling blue or experiencing a bad day. Persistent feelings of fatigue, anxiety, sadness, or hopelessness that last for 2 weeks or more are common symptoms of depression. Lost interest in once enjoyed activities, sleep problems, digestive problems, chronic headaches, ongoing pessimism, or suicidal thoughts are also symptoms. For others, feelings of guilt, worthlessness, or helplessness are common. Along with the resulting inattention and anxiety at work, many of these symptoms often precede acting out with displays of anger, drug and/or alcohol abuse, work addiction, or risky behavior at home. You can see why it is so important to recognize the symptoms and seek help. And treatment is simple and effective. Usually, medication, talk therapy, or a combination of both begins to relieve symptoms in a matter of weeks. Think about it. Are you endangering yourself or anyone else? Are you able to focus? Employees need to be able to recognize the symptoms of depression and know they can get help. Depression doesn't just go away, but appropriate treatment successfully helps most people. Successfully recognizing the symptoms is the first step. Seeking professional help to deal with these symptoms is critical. You must realize that you cannot correct the condition yourself. Know the symptoms and know what to do. Left untreated, depression can worsen. When day-to-day operations involve safely moving thousands of trains to transport our customers' goods, each employee bears an awesome responsibility. You must be able to think quickly and clearly. A lack of concentration caused by depression, anxiety, or any other reasons can have disastrous consequences. Know what to look for. Be able to recognize the symptoms in yourself and others. If you experience the blues or bad days lasting for 2 weeks or more, feel chronic fatigue, anxiety, persistent sadness, hopelessness, experience sleep problems, pessimism, guilt, or worthlessness, or have displayed fits of anger, drug, and/or alcohol abuse, with any of these resulting in inattention or the loss of concentration, seek help immediately. In the worst cases, depression increases the risk of suicide. If you or someone you know is having suicidal thoughts or considering suicide, get immediate help any way you can. Call 911 if the threat is imminent. Call 1-800-SUICIDE or 1-800-273-TALK to be connected to a trained counselor at a nearby suicide crisis center. Go to a nearby hospital, emergency room, or call your personal physician. Getting help for depression is important for you, your family, and your co-workers. Contact your doctor and set up an appointment for a physical examination. Sometimes depression can result from an ongoing physical condition or as a side effect of current medication. Get a complete clinical evaluation. Review your medical history with your doctor. Include and review any lifestyle changes or emotional events. With your doctor, plan a schedule of periodic health exams and set a course for a healthier lifestyle. If you find that you suffer from depression, discuss appropriate treatment with your doctor. While everyone is different, recent research suggests that an appropriate combination of medication and talk therapy is the most effective treatment for depression. So what's available to help you? As a Union Pacific employee, you can always call the Employee Assistance Hotline at 1-800-779-1212 for professional and confidential consultation. There are confidential evaluation, information, and educational materials available for the asking from Harris Health Trends at 1-888-767-0169. Also available are educational materials under a variety of associated topics from your regional health coordinator or occupational health nurse. Also, check out the Union Pacific employee website for information covering depression and other health issues. Other valuable websites include Men and Mental Health, the National Institute of Mental Health, the Depression and Bipolar Support Alliance, and the National Foundation for Depressive Illness.